One thing that is often surprising to people to learn about migraine is how prevalent and how disabling a condition it is. Participants said that very often the pharmacological treatments that are available to them, the side effects are actually worse than the symptoms they're experiencing of their condition. So when the cure is worse than the disease, so to speak, even though there's no cure for migraine, when the treatments are tougher to manage and function through than the symptoms of what you're dealing with, which is already the 6th most disabling condition in the world, that leaves people with very few options. What a lot of people do as part of their self-management strategies is start engaging these complementary and alternative approaches. Things like natural supplements and vitamins, that's the biggest type of complementary approaches used. Meditation, yoga, massage. So in this study, we were interested in having conversations with people from diverse social locations. So people with lower levels of education, people who have experienced violence, people who are part of racialized populations that have migraine, and ask, what are you doing to manage? What do you want us to know more about as healthcare providers? What sort of things can we do to support your management of migraine better? What came up immediately in all the focus groups that we weren't anticipating that this would be what the direction the conversations went was that people really wanted to talk more about these complementary and integrative options. People who occupy these more marginalized social locations have increased incidence and prevalence and severity of migraine. And these are precisely the groups of people that are being completely missed by the very high-tech, high-cost management approaches that are most often emphasized in the migraine world. So migraine is actually a health equity issue, and it is very rarely understood that way. We don't really emphasize a lot of research and clinical time in exploring these more complementary and alternative and integrative options, but our findings indicated that we really need to.